You can imagine how much money would go to development that is wasted on allowances and parks and you know, all these things that we're seeing, you know, in the public offices and state offices, and you know, those working in the counties are enjoying.
Wow. And I know the Salaries and Remuneration Commission, most of the time Kenyans connect with it when particularly they are dealing with MCAs and with members of parliament. One, we now have a devolved system of government, and the public finance management law and framework, we envision for ourselves that 70% of our revenue would go into development, but we barely, and 30 would go into recurrent expenditure, so salaries and so on. But year in, year out, we barely manage 30% at any level going into development. And even to resource that continuously, we have to borrow. Now, I think we need to question two things. And when that is cited for the counties, I won't go too much into MCAs. They take a huge chunk of that. But let's recall two things. At the county level, you must resource certain essential services. And at the national level, you have to resource things like education. So we must employ enough teachers. If we build structures worth 70% of the budget, then it would be a disservice to our children if we employ a ratio of 30% teachers to teach in an education facility where we have invested 30%. So at the county level, it has been a discussion because health workers take a significant amount of that particular budget. Yet most of the time they still complain they are underpaid. So should we put that as a recurrent expenditure on salary or development? Is it time to review this 30-70 based on our realities? Okay? And as we do all this, that particular level of employment, we have not managed to absorb even 40% of the people who ought to be absorbed into different employment spaces based on their skills. We have teachers who are unemployed. We have medical health workers who are unemployed. So if we review that, is it time to say, reduce the wards? That way, you have less MCAs and free some money to employ the skill set that we require. Employ more health workers, employ more agricultural extension officers that will support our farmers to manage this better. So I have always been hesitant to comment that the highest austerity measure is to reduce the wage bill. If we are overpaying, then we should reduce. Allowances need to come down, okay? But we barely have enough workforce to deliver on the services, government services. And we have to remember, government services is not just what you get in a Huduma center. What your child gets when they go to an ECD center is a government service. Children who are in the early childhood development stage are still walking 4 kilometers in certain counties in this country. So I think there's a bit of a disconnect. That we need to have a discussion, and we need to maybe get a disaggregated report that shows this is what the political class take. This is what is left for the other wages. Then that way we know where to rationalize. But just a blanket, let's cut, we will cause more pain.